Hi, I'm Dr. Shelly Greenfield. I'm the Chief Academic Officer and also the Director of the Alcohol, Drugs, and Addiction Health Services Research and Education Program at McLean Hospital. And these are the answers to some of the most frequently asked questions about substance use disorders. What is substance abuse? So substance abuse is a very commonly used term, but we don't use it as frequently medically anymore. The reason is that we know that substance use disorders are highly stigmatized conditions, and what we've learned through research is that the term substance abuse carries with it a high level of stigma. Instead, we talk about substance problems and substance use disorders. Substance use disorders are a medical condition diagnosed like other medical conditions by a constellation of symptoms across several different domains. What are the characteristics of substance use disorders? So we diagnose substance use disorders using 5 categories. The 5 categories are loss of control over use, social impairment or social consequences as a result of use, risky use of substances, tolerance, and withdrawal. So when we talk about loss of control over use, what we're talking about is that you may have had unsuccessful attempts to cut back or stop using in the past. You may find yourself using more of a substance than you intend to use, or using it for longer periods of time. Your use of substances impairs your ability to carry out major roles in your life, such as work or school or your family life. And then we have risky use. When we talk about risky use, we're talking about using substances in a way that physically endangers yourself or other people. So for example, if you were to drive under the influence. Another risky use is to continue using substances in spite of knowing that it could worsen a medical or a mental health condition. Tolerance means that you're using more of a substance to achieve a certain effect, so needing more to get to that same effect. And finally, withdrawal. That actually means that when you stop using a substance, there's a constellation of symptoms that you feel upon suddenly ceasing to use a substance. And these are different substance by substance. One thing that's really important is the symptoms you have determine whether you have a mild substance use disorder, moderate, or one that's more severe. This helps us determine what types of treatment would be most helpful to you. What are the most common addictions? In 2018, more than 20 million Americans had a substance use disorder. That included about 14 million American adults 12 and over who had an alcohol use disorder. It included 4.4 million Americans with a cannabis use disorder and 2 million Americans with an opioid use disorder. According to the Centers for Disease Control, about 34 million Americans also smoked tobacco. What are the risk factors for addiction or substance use disorders? There are 5 main risk factors for having a substance use disorder. The first, like in many other medical conditions, is a family history, often among a primary relative like a parent, a sibling, but even in a grandparent of a specific substance use disorder. A second is the earlier age of initiation of use of any substance. That's a risk for developing a substance use disorder later in life. The third is sex and gender. In fact, more men than women in the United States and actually globally have a substance use disorder. That said, what we know, for example, for women who might develop an alcohol use disorder, they are more likely to progress more quickly to serious medical consequences of their use disorder. Fourth, we know that early childhood adverse experiences, such as sexual abuse or physical abuse, can actually pose a risk factor for many health conditions, and that is also true for substance use disorders. And finally, fifth, having certain mental health conditions or psychiatric disorders, such as a mood or an anxiety disorder, these can also be certain risk factors for certain substance use disorders. Who is at risk for addiction? Addiction does not discriminate. It affects all people everywhere across the country and the globe, across all sociodemographic groups, across all genders, races, and ethnicity. How do I know if I have an addiction problem? It's a really good idea to talk with a doctor, a physician, another clinician that you trust, and discuss your concerns. Some of the things you might have in your mind when you are thinking about whether or not you are struggling with a substance are things like the following. Am I using more than I intended to use or for longer periods of time? Have I tried to cut back or cut down on my use and have had a very hard time doing that? Am I spending less time doing something that I used to really like to do because I'm spending more time using substances or recovering from substances? And when I'm not using a substance, am I thinking about it a lot? Am I craving that substance? Is substance use creating problems for me in some of the major ways in which I spend my life, such as at work or at school or in my family or my community. Has somebody told me that it would be better for me to stop or cut back my use because of a medical condition or because of a mental health condition, but I find that I'm using anyway? Have I noticed that when I abruptly stop using a substance, I develop symptoms that might be consistent with some type of withdrawal? I feel really bad after I suddenly stop using. Am I needing to use more of a substance than I used to use to achieve the same effect that I used to be able to get? And so if you're thinking about any of those things and worrying and wondering about them, it's a really good idea to have an opportunity to talk with a trusted clinician who can help you assess whether substances are creating problems for you in your life and whether you have a substance use disorder. Have there been more problems with addiction because of the COVID-19 pandemic? Yes, we've actually seen a rise in a number of mental health conditions and substance use disorders during the COVID-19 pandemic. One thing that we know is under stress, people sometimes start to use substances as a means of trying to manage and cope with those things. We know that there were people before the pandemic came who already had a substance use disorder, or people who were struggling with substances. And one thing we know is that the isolation that the COVID-19 pandemic brought with it made it harder for those individuals to connect with care and get needed care during the pandemic. How is substance use disorder diagnosed? Most commonly, a substance use disorder will be diagnosed by a physician, such as a primary care physician, a psychiatrist, an addiction psychiatrist, or another qualified clinician, such as another primary care clinician, another mental health clinician. A clinician will take a careful history of your current substance use and any problems it may be causing you, past history of substance use, your medical history, your mental health history, and your family history, among some other questions as well. In addition, sometimes laboratory tests and a physical exam can help us understand whether substances have caused any physical or medical problems as well. Is substance use disorder a mental health issue? Yes, substance use disorder is a mental health issue, and substance use disorder is a medical condition. That's because substances affect both your brain and your body. Another thing that's really important to know is that people with substance use disorders often have co-occurring other mental health conditions, and these can include depression, anxiety, post-traumatic stress disorder, eating disorders, and other mental health conditions as well. It's important to treat both the mental health conditions in addition to the substance use disorder in order for people to get well and stay well. People with mood, anxiety, or trauma-related disorders are also at greater risk of having a substance use disorder than people without those disorders. What are the consequences of substance use disorder? There are many health and mental health consequences of substance use disorders, and also many social consequences for people's work, school, and family lives. They are also potentially fatal conditions in terms of possible overdose from certain substances like opioids or prescription medications, and they can have long-term effects on people's other medical conditions such as cancer, heart disease, liver disease, brain health, cognition, and other mental health conditions as well. Substance use disorders can also adversely affect pregnancy and fetal development. Substance use disorders can affect people's most important relationships with family and friends, and that's because sometimes people find there's a biological drive to use substances at the expense of their most important personal relationships. How do I approach a loved one about their substance use disorder or substance problems? That's a really good question. First and foremost, it's really important to educate yourself about substance use disorders and also consider getting your own support. If you want to approach somebody with a substance use disorder, I would suggest that you use sentences that begin with the word I. I care about you. I care about your health and your well-being. I have these concerns. I'm here for you. You can also offer to go with a person to help them either find a clinician to talk with or to accompany them to an appointment if that would be helpful to them. How do you treat substance use disorder? We have many excellent treatments available for substance use disorders that are based on decades of research. We have medication treatments and behavioral treatments. For example, we have 3 FDA-approved medications for opioid use disorders. We have 3 FDA-approved medications for alcohol use disorders, and we have multiple FDA-approved medications for tobacco use disorders. In addition, We have different types of behavioral treatments that include individual, group, and family counseling. Some of these are cognitive behavioral therapies, relapse prevention therapies, and others. We also have specific therapies and treatments for women. We have those treatments for people who have substance use disorders and other co-occurring mental health conditions, such as post-traumatic stress disorder or bipolar disorder. In addition to these therapies, mutual help therapies can also be helpful to patients, and those include things like Alcoholics Anonymous, or AA, and Narcotics Anonymous, or NA. Where can I get treatment for my addiction? In many cases, clinicians will be able to provide treatment in their offices. Other times, it'll be important for a person to have more services, and those can actually take place as in inpatient programs, in residential programs, and sometimes in outpatient programs. It depends on what will be most helpful to an individual with substance use disorders to get them well and to help them stay well. What else should I know about addiction? The main message is that we have many treatments to offer patients with substance use disorders. These treatments are based on research and they are effective. We have medication treatments and we have behavioral therapies. What we need to be able to do is get the treatments to the patients and the patients to the treatments so that people have access to treatment that works for them so that they can get better and they can stay better. Treatment for substance use disorder works. There are effective treatments available for patients and their families. What resources are available? You can find many helpful resources on the websites for NIDA, NIAAA, and SAMHSA, which will include educational resources for patients and their families, as well as treatment resources. And for additional resources, please click below. Thank you for joining me today. I'm Dr. Shelly Greenfield, and at McLean Hospital, Mass General Brigham, we're here for you.